Bypass surgery, also called coronary artery bypass grafting or CABG, is one of the most powerful life-saving procedures in modern cardiology, and for many patients it restores blood flow to the heart, relieves chest pain, improves breathing, increases stamina, and dramatically reduces the risk of a fatal heart attack. But while we often focus only on the benefits, it is equally important to understand that bypass surgery is still a major open-heart operation, and like any major surgery it carries risks, side effects, and recovery challenges that every patient and every family must clearly understand, because knowledge is what keeps you safe, knowledge is what prevents complications, and knowledge is what helps you recognize danger early before it becomes life-threatening. So today I want to talk to you not just as a doctor but as someone who would give the same advice to my own family members, explaining what truly happens before, during, and after bypass surgery, what is normal, what is expected, what should worry you, and most importantly what you can do to reduce risks and heal faster, because surgery is only 50% of the treatment and recovery care is the other 50%. Let us start with understanding that bypass surgery involves taking a healthy blood vessel from the leg, chest, or arm and using it to create a new pathway around blocked coronary arteries so that oxygen-rich blood can reach the heart muscle again. And while this sounds straightforward, the body still goes through significant stress including anesthesia, blood loss, temporary heart-lung machine support, inflammation, and immune response, and because of this the first group of risks are immediate surgical risks such as bleeding, which may require blood transfusion or sometimes re-exploration in the operating room, infections at the chest incision or leg wound which can delay healing especially in diabetic patients, irregular heartbeats like atrial fibrillation which are extremely common in the first few days and may cause palpitations or dizziness but are usually treatable, breathing difficulties because the lungs temporarily become weak after anesthesia and lying in bed, kidney strain due to changes in blood pressure during surgery, and in rare cases serious complications like stroke or heart attack during or shortly after the procedure. And while these sound frightening, remember that most of these risks are carefully monitored in the ICU and managed promptly, but the real challenge begins after discharge when patients assume that surgery is over and life goes back to normal, which is not true, because the second category of problems are early recovery side effects that happen at home and are often misunderstood, such as fatigue which can last for weeks because your body is using enormous energy to heal the chest bone and tissues, mild chest pain or tightness which is often muscular and not cardiac but can create anxiety, swelling in the legs especially if a vein was removed, mood swings, or sadness which occur due to hormonal changes and stress of surgery, poor sleep, constipation from pain medicines, loss of appetite, and temporary memory or concentration issues sometimes called post-surgery brain fog. And many patients worry unnecessarily about these symptoms when in fact they are common and improve gradually with walking, breathing exercises, hydration, and proper nutrition. But what truly concerns me as a cardiologist are preventable complications that happen because of mistakes, and this is where education becomes life-saving. For example, some patients skip their medications because they feel better, or double doses because they forgot, or stop blood thinners due to fear of bleeding, which can lead to clot formation and heart attack. Some patients avoid walking due to fear that activity may harm the heart, which ironically weakens the heart further and delays recovery. Others return to heavy lifting too soon, which can damage the healing breastbone. Some ignore wound redness or fever thinking it is normal and end up with severe infections. Many continue smoking or eating oily salty foods which slowly block the new grafts again. And these lifestyle errors are unfortunately a major reason why patients land back in the hospital within months. So let me explain what you must actively do to stay safe. First, take every medication exactly as prescribed, including antiplatelets, statins, blood pressure medicines, and diabetes control drugs, because these protect your grafts like a shield. Second, walk every day, starting slowly from a few minutes and increasing gradually, because walking improves circulation, strengthens lungs, prevents clots, and builds confidence. Third, follow a strict heart-healthy diet rich in vegetables, fruits, whole grains, lean proteins, nuts, seeds, and healthy fats, while avoiding fried foods, processed snacks, excess salt, and sugary drinks. Fourth, practice deep breathing and incentive spirometry to prevent lung infections. Fifth, monitor your wounds daily for redness, discharge, or swelling. Sixth, manage stress through meditation, prayer, light music, or family support, because mental recovery is just as important as physical healing. Seventh, attend cardiac rehabilitation sessions if available, because supervised exercise programs dramatically reduce complications and improve survival. And eighth, know the red flag symptoms that require immediate medical attention, such as severe chest pressure, sudden breathlessness, fainting, persistent high fever, uncontrolled palpitations, leg swelling with pain, confusion, or sudden weakness of face or limbs, which could indicate stroke. And never ignore these signs thinking they will pass, because early action saves lives. And remember that bypass surgery is not a cure but a second chance, a reset button that gives you an opportunity to change habits permanently. Because if you return to old behaviors, the blockages can return. But if you adopt healthy living, your grafts can last many years and you can enjoy a long, active life. And I want you to imagine this surgery not as an ending but as a new beginning, where every step you take, every healthy meal you choose, every tablet you swallow on time, every cigarette you refuse, every walk you complete, and every follow-up visit you attend is an investment in your heart's future. And as someone who has treated thousands of patients, I can tell you that the difference between those who thrive and those who struggle is not luck or age or even severity of disease, but discipline and awareness. The patients who listen, learn, and act responsibly recover faster, feel stronger, and rarely return to the hospital, while those who ignore advice often face repeated complications. So if you or your loved one is preparing for bypass surgery or recovering from it, stay informed, stay consistent, stay hopeful, because modern medicine combined with smart self-care can give you decades of healthy life. And my message to you is simple: respect the surgery, respect the recovery, follow medical guidance sincerely, and treat your heart like something precious, because it truly is. And if you do this faithfully, you will not just survive bypass surgery, you will come back stronger, safer, and healthier than ever before.